in South Africa. All our eyes are on the rainbow nation of South Africa at the moment with the World Cup well underway. We've had our eyes on it for over 15 years now, and I can tell you that on the other side of the rainbow, it's not such a pretty picture. There's sprawling shack communities where you'll see disease, poverty, unemployment, lack of education, lack of healthcare. 5.7 million people are living with HIV. That's sometimes 1 in 3 in the communities where we're working. And 1.5 million children are orphans. At MaAfrika Tikkun, our vision is to transform these communities by focusing on healthcare and education. We run child development programs from community centres in 5 townships that are reaching over 1,600 children. And we run community outreach programs with a healthcare focus that are reaching well over 7,000 beneficiaries. Nelson Mandela, who we're very proud to say is our patron, has hailed our programs as a miracle. We think that the solution of tackling the healthcare issues in the townships is community outreach. We've trained 270 people from the local communities themselves to be home-based caregivers, to go out and visit homes and identify where there are homes where there are sick family members or vulnerable children. We feel that by training the local community, we're encouraging them to take ownership of a situation. We're also ensuring that the knowledge and skills that we pass on are kept in the communities, and we're providing employment opportunities. In the Western Cape, where Cape Town is, we are running a very successful primary healthcare programme. We've trained 180 people to provide primary healthcare, and they're currently visiting around 3,000 homes every month. A typical visit might involve talking a family through simple healthcare measures that you or I might take for granted, like how to brush their teeth properly or keep their home clean. If there's a child in the house, then they would check their medical card that they're the right weight, that they're up to date with their immunisations. If there's a sick family member, they would support the family in helping that person to get better, and they would make clinic referrals where necessary. They would also be able to make large-scale interventions, such as recently there was a measles outbreak in the townships, and they were able to provide immunisations, vaccinations, for over 4,000 people. I recently went to Cape Town myself and went on a home visit with a couple of ladies. This is Irene and Bruseka. And Bruseka was really proud to tell me that this mother that you see there, when she went into this home, the baby was really looking malnourished and underweight. And she noticed that the mother was feeding the baby with cow's milk. So she told the mother that she really should be breastfeeding her baby. And within 3 months, the baby was gaining weight. And you can see how healthy she's looking now. We want to replicate this model of primary health care in a community where we're already working just outside of Johannesburg called Orange Farm. Currently, 11 home-based caregivers are supporting 150 families in the community. But our primary healthcare program coordinator, Delia, wants to go there and professionally train those people to be primary health caregivers. Let me introduce you to Lulu. She's one of the caregivers that's currently in Orange Farm. Before she was working for MaAfrika Tikkun, she was really struggling to take care of her family of 5 children. She was working in a laundry and earning 30 rand a month, that's less than £3. She's now been trained by MaAfrika Tikkun to be a home-based caregiver. She's a confident mother, well able to provide for her children, and a really dedicated worker. She's also gone on to train 10 more people to be home-based caregivers in her community. She and they want to go through the professional training to provide the primary healthcare programme. Lulu wanted an opportunity just to tell you for herself just how much this means to her. I just apologise in advance for the very amateur nature of this video. It was just done on her phone. And also when she mentions 69 days, that's the training that she's already been through us.
Hi, I'm Bonaventure Lulu Mudiakhosh. I'm doing home-based care in Orange Farm. I'm working with 10 other women. I was trained by MaAfrika Tikkun to do 69 days. Now I'm transferring that skill to other women. We've got each and every caregiver has got 10 clients. What we normally do at their houses, we clean their houses, educate them, make sure that they take their medication regularly. And then if they can't go to the clinic, we go there and test and fetch their medication. And I would like to thank MaAfrika Tikkun for transforming our community. Thank you, Tikkun. We love you so much.
If we were to raise £5,000 tonight, it would enable us to provide professional training for 2 caregivers in Orange Farm, plus enable 3 more people to be trained from scratch and pay them a stipend of £80 a month and provide medical equipment. If we were able to raise any more than this, for every £1,600 we raise, 1 more person can be trained and paid a stipend and be enabled to provide support to 10 more families in Orange Farm. I hope you'll give generously tonight. I also hope you'll continue to enjoy the World Cup. But as you're watching it, whether you're in South Africa or watching it on television over here, please would you remember us and the communities that we're working in, and thank you for helping us to transform them.